patients here in India, we think are very demanding. They ask us whether they can squat, whether they can do all this agricultural stuff.
Yes.
How do patients back home in the US, are they also demanding? How are the cultural differences? What all activities do they demand? And does robotics help in any ways to bring them back their lost function?
There are some cultural differences from a kneeling squatting standpoint, for example, maybe a cultural thing. But in the U.S., what we've seen at least, people used to have joint replacement in their 80s, right? And it was only for pain control. That's no longer true.
Yeah.
People are coming at a much younger age. In fact, the age of joint replacement in the U.S. goes down every year, and their demand is higher. So what do they want to get back to? Absolutely everything. They want to get back, sure, to yoga and gym workouts, but also skiing. I mean, snow skiing, water skiing. They really don't want any limitations at all. Now, your comment about does robotics make that easier? That's certainly the promise of robotics. Remember, we said it's up to the surgeon to make the right decisions, and there's so much that goes into surgery, not just the metal and plastic, but the physical therapy and rehab. Yeah. So it's a large process, but robots are part of that process that are trying to do that joint replacement better so that there are no limitations.
I guess we with the robotics, we can kind of shape match the implants to the patient's anatomy, and that gives them more functional abilities, and maybe they can return to work faster because lesser blood loss. We are not touching the ligaments or muscles more. So I guess robotics is the way forward for a better function for the patients.